année, vous le
Every
savez,
year,
4
you
projets
probably
sont
noticed
récompensés par la
4 projects
Fondation
are
Pierre Fabre. 4
awarded
initiatives
by
en
the
e-santé
Pierre
qui ont le
Fabre
potentiel d'améliorer l'accès aux
Foundation,
soins et aux
4
médicaments de
initiatives
qualité pour les
that could
populations
improve the
défavorisées.
situation
4 équipes porteurs de
for
projets
various
qui se voient
populations.
décerner le prix
Each
Odess.
year,
Je
4
vous propose
projects are
d'accueillir les 2
awarded
premières
prizes by
équipes
the
sur
Pierre Fabre
scène. On commence par la
Foundation.
première
4
équipe,
project teams are
les
awarded the
premiers
Odess
lauréats.
Prize. I
Il
invite you
s'agit
to
du
welcome the
projet
first
Digital
to
Disease
the
Surveillance,
stage
DDS, qu'on va découvrir en
with
vidéo
the
pendant que
DDS, the Digital
Wishan,
Disease
Bunia,
Survey,
Kitty et
as
Supanza
Wishan,
Surya viennent nous
Bunya,
retrouver,
Kitty
s'il vous plaît.
Korn, and Supanza Surya join us on stage.
The digital disease surveillance addresses the urgent need for faster and more accurate disease surveillance, outbreak detection, and also streamline interagency data sharing to enhance public health emergency preparedness and response. Digital disease surveillance operated nationwide across Thailand, including remote area and underserved community. It served the diverse population, including rural, poor, or illiterate, through accessible digital tools. The decision maker, epidemiologists, and frontline healthcare worker, and finally the general public will benefit from this system. Our system features user-friendly and automated infographic to enhance the public communication and delivery early warning message to the messaging platform. We utilize the hybrid data storage system, real-time APIs, functionality, and also mobile access to ensure the reliability of the data, even for remote areas. Since we implementation, the DDS can collect more than 97% coverage of the healthcare facility. It also has the early warning capacity and also accelerated the outbreak response to reduce the manual workload. Challenges include the limited AI infrastructure and also skilled personnel who can utilize the unstructured data. We try to address that by training our staff, send them to some kind of boot camp, and also planning to invest some kind of computational capacity. We aim to adopt the large language models for unstructured data extraction and queuing. We also plan to use the computer vision to extract some image from satellite or maybe state view and use those all insights to inform the comprehensive risk assessment. We seek for the expert to validate and visibility recognition of our digital disease surveillance system as a global model for digital disease surveillance and enable us to scale faster. The award would accelerate the technical development and expand our impact.
Voilà pour le projet Digital Disease Surveillance, DDS. Bonjour Vishan. Yes, you can.
That is it for DDS.
I have a couple questions for you, and we'll have more after that. But quelques questions. Comment vous est venue cette idée?
Did you have this idea?
Okay. Firstly, I would to thank for invitations and allow us. I mean, Thailand is a very small country, and to come here is very, very meaningful for us. Yeah. Back to your question. How the ideas come. I would like to begin with introduce you to know a little bit about the disease surveillance system, because I guess that some of the audience may not in the public health field. So the disease surveillance system is the system that we use to monitor, to correct the data, especially for the communicable disease. So it's like the ear and the eye of the public health that tell us what happened and where it happened, and how fast of the situation, and what the public health can do in order to slow the situation. So that's kind of the surveillance system. So in Thailand, we begin the surveillance system by using the paper report, and continue to be like the email, Excel file, web application, specific program. But most of the program that I mentioned, it depends on our staff to report the case into our system. So the system run for maybe 50 year, almost my age now. So it take a long time, but you know, the change is the COVID pandemic. Is when the COVID come, our system that we think is good, but when the pandemic come, the system is kind of overwhelming, and especially the people at the frontline responder, they don't have time to key or to report the data to us. So the idea come at that time. Yeah. And actually, I would like to mention two people that throw this idea to us. One is Dr. Darin Arichokchai. He is the key person that he saw the question. Why don't we instead of the report individually, why don't we connect the hospital information system into the disease control data? So that idea has come up to the room, and is the beginning of the disease digital disease surveillance, as I mentioned.
Expliquez-nous, Vishan, qu'est-ce que vous allez faire de toutes ces données
Can
que
you
vous collectez?
explain
What
what
are
you're
you
going to do with all this data you're collecting?
Okay. That is a great question. You know, DDS system right now, the data come into our system is approximately 6 to 10 million data that's come to our system. But the data is mean nothing if we don't use that data for public health action. So what we have done is that, as Dr. Subhanat mentioned in the video, they bring the local authority, our stakeholder, what they're going to do with the number of the data in the system, and they come up with the idea that about use the digital to show like the dashboard, monitor the situation, and to do like the alert system, and to extract the information like the forecasting or predicting the situation, and then it is transform the data into information. So this kind of useful system.
Et je rappelle, parce que je ne l'ai pas dit, que vous êtes directeur de la division de
And you're
l'épidémiologie au
head
département
of
du contrôle des maladies pour le ministère de la
epidemiology
Santé
for
publique du
Ministry of
Thaïlande.
Health of
Merci, je voudrais
Thailand.
qu'on fasse monter le
Thank you
partenaire
very
qui va vous
much.
remettre le
The
prix.
partner who's
Il
going to
s'agit
give
de
you the award,
Jay Ganesha Karan, qui est
Udayasa
directeur exécutif
Karan,
du Asia
who is
e-Health
head
Information
of
Network.
Asia Information
Merci de
Health
l'accueillir.
Information Network.
Cher Jay, venez nous retrouver. Et on va rester debout. Yes, we're going to stand for this. Voilà, on va faire une photo. Lydie.
Let's take a picture. Great.
Jay, before you go back to the room, just one question. Tell us, qu'est-ce qui a retenu votre attention sur ce prix? Vous pouvez rester avec nous. Qu'est-ce qui a retenu votre attention plus particulièrement? What drew your attention on this project more particularly?
For me, it was one of the very interesting projects that we have come across, and especially so from our region. And the speciality that I liked from this project is the approach. Interoperability among health information systems is a global issue, and then even among the public hospitals, it is impossible or even impractical to have all of them use the same system. Especially if you do not have a minimal data set or something that's defined nationally and then have it kind of adopted, it's difficult. But the approach to get around is very interesting. So what they did is, like, irrespective of the hospital information systems that they use, the government, actually the MOPH, the Ministry of Public Health, provided the API to pull the data from the hospital information systems. So this is like getting around the issue. And then also that they have not left behind the hospitals which do not have a hospital information system, which is very important. When we talk about a nationwide disease surveillance program, to not leave out those facilities which may not have in health hospital information system is very important. So maybe they are storing that on Excel sheets, as he mentioned, or on a paper. But by providing an online system with which they can actually pull in the data or put in the data, and then that comes to the DDS, is very interesting. And the second point is like also, I saw that government funding or the public funding was initially less than half. It was also coming from the overseas or the development partners. But going further, I see there is a diversification where the government funding has actually gone up, whereas the other funding has got. This actually also shows a very interesting insight that the government is very serious about this. And then also, I believe they worked with the Ministry of IT or Science and Technology. So that's also another approach which AHIN believes in, to have this convergence or a government-wide interest on digital health programs. So because Ministry of Health has a certain core competence that is more on the health, but then you have other things like last mile connectivity or maintenance of ICT infrastructure, for which there are other ministries which are which have the core competence. So by working together with them, I think they have achieved. And then also they built in the predictive models, which is also very future looking. So these are the things that I liked.
Perfect.
Thank you very much.
Thank you. Thank you very much. You may want to join your room. Vishan, you stay with us because we'll have questions. Jay, I invite you to go back to your seat. Yes. Thank you very much. Merci beaucoup. On passe au second projet récompensé et il s'agit de Z-waka et j'appelle Dr.
Z-waka, Isabelle
et Patrick Fuchs à venir nous retrouver pendant qu'on découvre le projet en vidéo, s'il vous plaît. Come join us on stage.
Are going to join us and come and join us on stage, please. Patrick Fuchs and Dr. Pine Point-Null.
Z-waka is a social learning platform that turns any busy smartphone into continuous medical education hub for the frontline providers. So the healthcare professional can get access to the resources and can exchange support within a trusted medical community. In many low and middle income countries, frontline providers often work in isolation with limited access to the update resources or support. We bridge this gap by offering accessible mobile-first learning and decision support tools that enhance clinical confidence and reduce preventable errors. We are currently operating across several low and middle income countries in Southeast Asia, including Myanmar, Vietnam, Cambodia, with expansion underway to several countries in this year. And these settings are often marked by political instability, workforce shortages, and also significant rural-urban disparities. Our beneficiaries are first, the frontline healthcare professionals who gained access to accredited programs, resources, and peer support through our digital platform. Secondly, the patients they serve, especially low-income communities in rural areas, benefit through better counseling, more timely care, and improved continuity. We use mobile-first technology to bring continuous medical education and patient engagement tools directly to the provider's smartphones, no special hardware needed. We've seen measurable improvements in healthcare provider knowledge, confidence, and engagement. For example, 60% of our trained GPs reported greater confidence in managing complex diseases. Completion rates of our programs are consistently high, often 2 to 3 times higher than the traditional training. As one example, in our family planning program in Myanmar, we saw a 45% improvement in knowledge that translates into a 15 to 20% rise in the patients receiving comprehensive counseling. Our innovation lies not in reinventing healthcare, but in reimagining how knowledge is delivered and skilled in fragile systems. We face many challenges. First, we need to earn the trust of healthcare providers in each new market. We need to build the credibility, and also content localization is also the key to success. Regulatory landscapes across the countries we serve. Each setting has its own policy, systems, and approval processes. To overcome these, we co-create content with the local experts, partner with the trusted institutions, and adapt our approach to each country's unique context. This year, we are expanding into several new markets beyond Southeast Asia, and on the product side, our engineering team is focusing a lot on embedding AI tools. Our vision is to support healthcare providers, not just before patient care, but during it, offering real-time, context-aware learning and decision support. We apply to Odess because we truly believe in the power of peer exchange, visibility, and shared purpose. Recognition by Odess is truly an honor for us. Thank you very much.
Voilà, le projet Z-waka. Kaine, merci d'être ici. Vous êtes fondatrice et CEO de Z-waka. Comment vous est venue
Thank you for being here. You're CEO and founder of Z-waka. How did it start?
Okay.
First of all, thank you very much for the invitation, and it's really such an honor to be here and connecting with the Odess community. So my name is Kain. I'm the founder of Z-waka. Together with me, Dr. Patrick is also here. I'm a medical doctor with a master's degree in healthcare informatics from the UK. So we are a Singapore headquarter, a social learning platform operating across different countries in Southeast Asia, including Myanmar, Vietnam, Cambodia, with several expansion underway into several countries this year, including Sri Lanka, Maldives, Brunei, Bangladesh, Thailand, and Philippines as well. So going back to your question, so growing up as a medical doctor and also growing up and working as a medical doctor in a small country like Myanmar, I saw every day how difficult it was for the patients to get connected to the right care, and also how the healthcare providers were often isolated with very much limited knowledge and also to access to the resources. And when we talk about the global medical guidelines, sometimes are not feasible for the providers in low resource settings like Myanmar. So that's something what I always wanted to change, and luckily I had the chance to work in the digital health space for the past decade with both private sector and public sector across both the developing world and developing countries, and that's how Z-waka started. So it's we started with a very simple idea to support and connect all the healthcare providers, especially in low resource settings, to provide the right knowledge where they need the most. So our vision is very simple and clear for every healthcare providers, no matter where they are, to get access to the real-time learning, support, and also patient engagement tools, so that ultimately to improve their clinical decision makings and also for better delivery of care. Thank you very much.
And Z-waka stands for?
Ça
veut dire quoi?
So it actually just comes from the Buddhist methodology, because Myanmar is a Buddhism country. So in the legendary, there is a medical doctor named Z-waka. In Indian language, I think you write it in Z-waka. So we wrote in a modernized way. So it's a medical doctor for Buddha.
I see. That's interesting. Tell us, what's the next step? La prochaine étape pour vous, c'est quoi?
What is the next step?
This year, so I also explained in our interview video as well. We are expanding across different countries in Southeast Asia and also beyond Southeast Asia. So, so ultimately, with a vision to become a truly regional and ultimately to become also a global platform that connects the providers and to provide the resources where they need the most. So we also this year developing and investing a lot in technology for better personalized learning, so that, for example, if a doctor looks up the information that they are unsure about, to be able to provide the right context-relevant information and guidance real time. And also, we are also developing in AI-integrated chatbots and patient engagement tools, so that actually for the provider-led patient enrollment, so that when the patient leaves the clinic, we can deliver health education, messages, information about the referral, and also for follow-up appointments for better medication adherence and so on. So these kind of things we are also investing as well. So ultimately, again, the vision is to support the providers, not only at the patient care before, not only for the trainee, beyond training, to provide the care during the time of consultation and also post-consultation.
Très bien, merci Kain. Thank you very much. We'll have your partner come up to deliver the prize. On va appeler Caroline Perrin, directrice exécutive du Geneva Digital Health Hub, to come up on stage. Merci Caroline de venir nous retrouver pour décerner le prix à Kain pour Z-waka.
She's going to come to award the prize to
Avec
Kain
Patrick
for
Fuchs
Z-waka
pour la
with
photo.
Dr. Patrick Fuchs for the photo.
Caroline, même question. Qu'est-ce qui a retenu votre attention
Same
sur ce
question for
projet
you,
plus
Caroline. What
particulièrement?
drew your attention on this project, more specifically?
Qui doit être là? Voilà. Expliquez-nous un petit peu.
Pour moi, venant du monde académique, je suis particulièrement sensible à l'importance de formation continuée. C'est la base de tout système de santé solide. Ce qui me touchait dans Z-waka, c'est l'impact très concret. C'est la manière dont ce projet, en collaboration avec des acteurs clés, le ministère des Santé, les
was working with
hôpitaux,
key
les
actors, with
universités,
Ministry of Health,
rendent
hospital,
l'information
universities. I thought
accessible
it was
à
extremely
des
concrete.
milliers de soignants,
Z-waka,
80 000
more than 80,000
améliorer
helpers
ainsi,
and caregivers are
le
working,
soin
and
pour les
there's
patients,
continuous
très
life
concrètement.
learning.
C'était donc un grand plaisir de vous donner le
And that's
prix
really
Odess
important. It
pour
was a
cette
great pleasure for me to award the
Merci
Odess
beaucoup. Je vous
Prize
invite
for
à
this
retrouver votre
fantastic
place dans la
project.
salle.
Thank you very
Et on va
much.
ouvrir maintenant
We're
une
going to
séquence de
open now
questions-réponses. So
a
you stay here with
Q&A
us.
session.
We'll probably have some questions. Des questions dans la salle et puis des
If you
questions
have, we'll
via
have
le
questions
chat.
in the room and via
Allez, on a
the
encore quelques minutes
chat.
avant la
A
pause
few
déjeuner.
minutes
Oui, on
before
vous amène un micro,
lunch
monsieur.
break.
Deuxième rang, s'il vous plaît. Micro anglais ou français?
French or English mic?
Italien, espagnol, comme vous voulez.
Italian or Spanish if you wish.
Il primero.
Oh, j'ai reçu un micro en français.
Très bien.
Yes, I
Bonjour.
had
Ma question,
an
c'est
English, French mic.
malheureusement, j'oublie le nom du monsieur.
Vishan.
Visha.
Visha.
Et félicitations pour,
Well,
pour
congratulations
le prix et
for
aussi
your
félicitations
award
pour le projet.
and for your
Ma
wonderful
question
project.
est, en
But
tant
my
qu'ancien de
question,
la surveillance,
I am
l'objectif
working
de tout système
surveillance,
de
and the
surveillance, c'est
objective for
d'améliorer
any
les
surveillance
indicateurs
system
de
is to
surveillance.
improve
Et,
surveillance
je voudrais
indicators.
juste savoir
I would like
s'il
to
peut parler un
know
peu de l'impact
if you could speak about
que
the
leur
impact
système a eu dans
that your system
l'amélioration,
had on
en
improving
premier des indicateurs de
the
surveillance,
surveillance
c'est-à-dire,
indicators. That is to
je
say,
ne sais pas dire ça en français, timeliness, completeness,
timeliness, completeness, all this.
mais surtout si ça apporte une amélioration
If
dans
it
la détection rapide
brought
des
an
épidémies.
improvement
Donc,
for
en gros,
to
l'impact
fight
sur
against
les
epidemics,
indicateurs de
what are the
surveillance
impact
concrets.
on surveillance
Merci.
indicators
Yes.
concretely? Please, thank you.
Thank you so much for the questions. That's it. Very important question actually, because when during the periods of development, we also discuss about this, and what we expect from the system is that the system have to be faster enough to detect what happened, especially for the outbreak, and then we send information back to the responder in the field in order to respond to the outbreak. And it shows in the real situation, because the system is designed to be like a real-time reporting system. So the number of cases is show is real-time. So at the central level, when we see the trend of the case, it's increasing, and in the system we can deep down into the provincial level and the sub-district level, so we can point out to the local and told them that this is not the normal situation. They have to do something. For example, like the dengue season and also the influenza seasonal, right? At this time, we also show them that the number of cases is increasing. They have to do something that to stop the spreading of the disease. This is, for example, that how we use the system to respond, and also we improve our surveillance system in order to control the outbreak.
Merci beaucoup, Vishan. Une question au second rang.
A
Ici,
question
ici.
here.
On vous apporte un micro. Anglais, français, italien, espagnol. Français.
French, please.
Ah, pardon, il y avait une question derrière en premier. Au fond, pardon, allez-y, madame. Bonjour.
Oui, bonjour et
Please
merci
go
beaucoup
ahead.
pour cette
Yes,
présentation.
thank you very much for this
J'étais
presentation.
très intéressée par
I was
la
very,
première présentation de monsieur en
I thought it
particulier.
was really
Et j'avais une question
paramount and very
concernant
interesting.
les données
I
qui
had
sont
a question
transférées.
about data that are transferred. You're working together with the Ministry of Health. Does it include data that are coming from private sector, data collection to prepare pandemics and epidemics? Do they include all data, including data, private data?
Okay, thank you for the questions. In our work, we have we call the legal system legal design and also the system design. And for the legal design, we have the regulation we call Communicable Disease Act that we put on the notifiable disease into our regulation. That means the regulation is for both the public and the private hospital. So it's kind of mandatory system that that all hospital on healthcare facility have to report to the government. It is our law, so we design in that way. And what we help the private sector is that we don't need to make the system is more complicated. You know, we use the digital tool, we use the API thing, so it's not the burden for the private sector. Just follow our instruction is more easy. So you see in the video that we have a coverage in the private very high.
Thank you very much for the answer. Question, oui.
Oui, merci beaucoup.
Thank you very much.
Le prénom c'est
Kaine.
Kaine. It's a question for you, Kaine. I'm very impressed by the work you have done, and I think the organizers were right in awarding you this wonderful prize. Because if I remember well, my first year I come from Congo, Democratic Republic, and I worked, and we had problems with orientation because we were isolated. And I'm asking you, with all the efforts you are deploying, how can you give for isolated health professionals, if there's a paraclinical diagnostic and they don't have the material, how do you deal with them? How can you tell them to take the right path in order to take the right decision?
How do you orient? How do you the professional?
I'm not fluent in English. Quel conseil il donne? Quel schéma il suit?
My question is, how would you redirect professionals, health professionals, so that they take the right decision in places? How do you redirect health professionals?
How do you make the right decision?
How do you redirect people?
So I think in case in the area where the healthcare provider don't have access to lab facility, what's your recommendation to this healthcare provider in case he's facing a complex disease?
Thank you very much. So what we are providing is a system and the platform where they can, of course, receive the training programs and all these resources before providing patient care. But we also have a very much active medical community, which is an online community. For example, a rural doctor. We have the same situation in Myanmar and Cambodia too. So if there is a rural doctor practicing and he doesn't know something to solve, just can simply write up the patient case summary and some information and ask for help in the community as well, where the peer can also support and provide him with, second opinions and this kind of information. So this is also something that we do. But before of course, the patient care is more about learning and resources, but at the time of real care, it's about the medical community support that we are trying to help and provide.
Thank you. Une dernière question, peut-être on a encore 1 ou 2 minutes.
Last question, you
might
have, we have 1 or 2 minutes. Do you have questions?
Dans la régie, pas de questions sur le chat. Il y a une question dans la salle au 3e rang.
There's a question here.
Yes. English, Mike.
This question is to Kaina, Dr. Kaina. So how do you, after this effort, how do you plan to actually scale up in the region going further? How do you actually provide the capacity building in the region, especially in digital health and training? Because in the medical system, usually people have a different accreditation, but digital health workforce is quite actually mobile. And then if you could make a system in such a way that it is acceptable across the globe, it will be a fantastic help especially for the digital health workforce. So how do you have any insights on how to go further? Because there are various countries follow various systems, but at the same time, can it be like a universal system of acceptance of the competence? Thank you.
Thank you very much. In terms of the technology and the platform, so we designed it for initially we started our pilot in Myanmar, which the resource is very much limited, and the providers sometimes usually have just a very busy smartphone. So sometimes it's more complicated, and we need to do a lot of thought processes. How can this doctor from a rural area can access to these resources? How do we make the application user friendly so that it's easy for everyone to use, and also the age divide as well. How can we make the platform also be accessible by the doctors in 60 or 70 year old, right? So we have to tweak a lot of processes, and finally I think the product is really good enough to be able to use in the resource limited setting. So from our experience, after we did all these processes and all the hard works in Myanmar, when we expand to a country like Vietnam or even Thailand and Philippines, which is a bit much more advanced than the doctors in Myanmar, the platform is actually very much easy and user friendly already. And in terms of I think the scaling up, the biggest barrier for us, or at least the challenge that we face, is every country has different regulatory landscape. So Vietnam has a different mechanism for providing CPD CME accreditation. Thailand is different. Singapore is different. So we still need to partner and trying to bind in the Ministry of Health, the stakeholders from different countries to accept the platform and to accept the data generated by our platform to be able to provide the accreditation to the doctor. So I think on the technology side, on the platform side, this is ready to use and very much well-functioned and designed for regionally and globally. So I think in order to scale up is just to build these connections, networks across different countries and try to bind from the stakeholders. So I think that's a major challenge for us and that we are trying to solve.
Thank you, Kyle. Merci. Y a-t-il d'autres questions? Une autre question dans la salle?
Do we have other questions?
Non, je vois pas de main qui se lève. Pas de questions sur le chat non plus.
On the chat,
bien, si c'est
we
le
don't have
cas,
any
on
other
va
question. Okay, we're going to
Bravo
congratulate
à tous les
Visham
deux.
and Kain again. Thank
Bravo
you very much.
pour
Well done.
ces
Well
projets
done
très
to both of
intéressants.
you for your
J'entends les
projects that are
historiques qui
extremely
travaillent.
interesting.